Hi, so this is Team Fibro AI, and with me here is a solution which is Fibroafya AI, which is basically a solution that is helping clinicians to detect fibroids at an early stage among women using artificial intelligence. So, so meet the team behind the innovation. We have Hampton, who is the AI developer, Valentine, and myself. And what is fibroid? So uterine fibroid, this is a disease that grows in the uterus of a woman. These cells can be cancerous, and due to the growth, they form a smooth muscle cell, and due to that, they are able to trigger the hormones around women, which is why they often grow during the reproductive years and may shrink when a woman is just around at her menopause. Who is at risk? The people who are at risk is women in the age of 35 to 45, because now they tend to have higher incidence and they develop fibroids earlier with more severe systems. But now this can only be detected when they are at the ages of 35 to 45. So what are the risks? The increased risk in maybe you can have some family history of fibroids, some obesity and high BMI, hypertension and diabetes. So the only way to protect this is through maybe the protective factors can be like multiple pregnancies, progesterone only contraceptives, maybe smoking and some regular physical exercise. So we have various types of fibroids like intramural fibroids which develop along the muscular wall of the uterus. We have subseral fibroids which grow on the outer uterine surface. We have submucosal fibroids, which is the least common, but located beneath the uterine lining, and the normal cervical fibroids. So, what are the common symptoms? We have heavy menstrual bleeding among women. We have the pelvic pain and pressure. We have reproductive challenges like during the maternal pregnancy complications, and then we have the acute complications as well. So, how are fibroids diagnosed? They are diagnosed through like a clinical assessment. You do a detailed medical history based on the symptoms that I've mentioned, and then you done some ultrasound imaging, advanced imaging where the MRI scans are taken for complex case analysis and specialized tests. So through this process, it takes a long time to really detect whether you have fibroids or not. And that is why we came up with our solution, which is basically helping clinicians to detect the disease at an early stage. So in our website, we have the AI-powered fibroid management system where you have 24/7 symptom tracking. You're able to track your symptoms for the patients. We also have the AI-powered health insights for the doctor and the clinical connection. So we also have a chatbot where you can interact with it and get you just tell it how you're feeling uh, throughout the day and what are your symptoms. So that is on the patient's dashboard. For the clinicians, if I log in into the clinician's dashboard, once you're sent to the lab and then an MRI scan is taken, once I upload into this system, I'm able to get the findings, the summary, and recommendation. Like in this case, it tells me the structure is a uterus, and then the summary it says that the image reveals a uterus with a significant enlargement and distortion of its shape. And then the recommendation tells you it recommends you to go to a finer gynecological evaluation. So through this, you're able to detect at a high, like at a first level. So with that also we have a place where you're able to just interact with your doctor on a one-to-one platform. As well, we have a place where a doctor manages your records from the last time you came for your visit to the next time you're supposed to be scheduled for your visit. We also have like this dashboard shows the gynecologist, which are the more upcoming appointments. So you're able to structure your patients in a more detailed manner. So like if your patient booked for this date, you're able to know this is when you're able to do a general checkup for your patient. Sorry. We also have a patient library, which is managed by the doctor, whereby for those people with pain management plan, there's a paid management plan, there's an insurance organization, there's a place where you go for your lab, for your care plans, for your admin, all those things. We also have a place which is a patient support center where you're able to have a one-on-one interaction with your doctor. It acts like your assistant, I mean. From there, we have now the part where the doctor is able to upload your image. I'm going to upload an image here, and we want to see if once a doctor uploads, is able to get the right analysis. So it's analyzing the image. So let's see. So based on what we've provided, it's able to tell you the structure of the uterus, the structure of the ovary, the structure of the anterior walls of the uterus as well, the endometrial cavity and the surrounding. So thank you so much, and I hope you consider Fibroafya AI as your go-to solution. Thank you.